Welcome back to the Hampton Roads Show. Whether it's something minor or major, surgery is scary. And a big part of those fears are what happens after the operating room. You want the best outcome and to get your life back to normal as quickly as possible. And so does your surgeon. The medical team at TPMG has found that a new approach to care called the ERAS protocol is working for their patients. Joining us now to tell us what the ERAS protocol is and why it works is Dr. Lisa Coleman, board-certified colon and rectal surgeon from TPMG Center for Colorectal Surgery. Dr. Coleman, welcome to the Hampton Roads Show.
Thank you so much for having me.
Okay, so ERAS, what does it stand for?
So ERAS is a program that we developed. It stands for Enhanced Recovery After Surgery. And in this case, we're talking about major abdominal surgeries like diverticulitis when you have an infection of your colon, colon cancer or rectal cancer, but it's not for the emergency type situation. It's for a planned surgery so that we can plan with this program for you to have the best outcome for the patient.
I know this is kind of silly to ask, but why is it important?
It is really important. That's a good question. I've been involved in championing this particular program with TPMG in combination with Mary Immaculate Hospital. There's evidence out there to show that these implementations of these plans will provide patients with better outcomes, less pain, faster recovery, faster back to work, basically faster back to your life. And we're bringing it for the first time to Hampton Roads.
Oh, good. So let's talk about the protocol and what are the elements. Kind of walk me through it.
The core to the ERAS program is it's a team approach. We're involving a lot of different players to include nursing, before surgery, after surgery, nutrition, physical therapy, and then anesthesia, obviously, during the surgery, and the surgeon also is involved. But we're looking at before surgery, educating the patient, both from a nutrition standpoint. That's not the time to lose weight. That's the time we want you to build your building blocks so that you can heal. We're going to also talk about your expectations of pain, how that's going to go before surgery, during surgery, and after surgery, and then how we can get you up and running and functioning thereafter.
Some people are concerned about medication after surgery, and I guess that's part of the protocol as well.
Well, as you know, we're in an opioid crisis right now nationally, right? This is what's in the headlines, and it's really important for us to make meaningful change in that process. So part of this, in terms of from a pain standpoint, is preoperatively, is talking to patients about expectation of pain, as well as starting to use some medications to minimize what your pain response is going to be during and after surgery.
Let's talk about what can someone expect from a physician who uses the ERAS approach.
A lot of communication, bottom line. A lot of communication. We're going to talk to you before the surgery again about expectations, what's going to be expected of you before you, what's the patient's role before surgery, setting up those expectations, having the patient meet with the nutritionist, having the patient meet with nursing prior and anesthesia prior, and then during the surgery and after the surgery, knowing what those expectations in terms of what is the patient's role? How do they play a role in improving their own outcome, and what are we doing to help them with that? And
something tells me that you've put it into place and you've seen a lot of success stories already. What kind of successes have you seen since implementing ERAS?
We are really having a lot of success. I would say one of the primary things that we're seeing is a decreased need for narcotics after surgery. Again, we're talking about the national opioid crisis. So a decreased need for narcotics after surgery, which helps you move around faster. It helps you get back to work faster. I would say about 50% of my patients right now, with the way that I've implemented this, they leave the hospital not on narcotics at all.
Wow.
We're using other adjuncts. And that's the first step to fighting this big national problem.
Everything that you mentioned is critical, especially the communication, because everybody who has surgery wants to have that type of relationship with their surgeon. Everything seems good.
They need to have that kind of communication. That's what we try to provide.
Dr. Coleman, thank you so much for joining us today and giving us some great information. Lisa Coleman, you can find her at TPMG for colorectal surgery. If you have any questions, you can contact her at 860 Omni Boulevard, Suite 108 in Newport News. You can call 757-874-1077 or find the information online at mytpmg.com.